Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, and welcome to the Monday Morning Minute. I'm Fitz, and this week on our Monday Morning Minute, we have a very special guest, John the Handpiece Guy. John the Handpiece Guy has helped Dr. Shatkin over a couple decades now. Easy. Repairing and helping him with his handpieces. So when you do the amount of implants that Dr. Shatkin does, you're going to need a good handpiece repair guy. And this is where John comes in. But we also at Shatkin F.I.R.S.T get a tremendous amount of calls about how to service and how to lubricate handpieces. We want you to keep this beautiful Aseptico handpiece for many, many years to come. So what John is going to do this morning is John's going to take a minute or two and explain exactly how you use our brand new lubricant at Shatkin F.I.R.S.T to maintain the handpiece. So John, tell us what you think.
Okay, so what we have here is a synthetic lubricant, and synthetic lubricants are best because they don't break down in the sterilization process. And most lubricants that you see on the market are mineral oil based, which do break down in the sterilization process. So that's why we recommend this lubricant. So what you're going to do is, after your procedure, you're going to take your lubricant and what we call an E-adapter tip, and that screws onto this top of this can.
And this is sold separately. And how long will this last?
This tip you can reuse with your new can. So as you replace your cans, you unscrew this tip and reuse it.
Perfect. Excellent.
So the way you want to use this is you shake your can, and within 15 minutes after you're done your procedure, it's imperative that you lubricate it in that time period, because during the procedure you get your fluids, saliva, blood will work their way up into the head of these handpieces. And if you don't lubricate within about 15 minutes of the end of the procedure, what happens is that blood can dry, and then that gets very, turns gritty, and that will start tearing up your bearings.
I think you explained to me once, it's almost like rust.
Yeah,
and it can really play havoc on the intricate parts that move.
It tears everything up.
Yeah.
So what we recommend then, of course, is within 15 minutes, and I put the handpiece in a bag like so, give the can a shake, you put your tip in, and you want to hold both sections because it is under pressure, and you shoot your lubricant in. And as you can see what came out, all that dirt, and you want to spray it again until clear lubricant comes out. And you can see how dirty that is.
Yeah.
So we're just going to keep shooting it until the lubricant comes out clear. And that's getting pretty clean right there.
And what is the average amount of times you'll have to spray it, would you say?
Well, if you take care of your handpieces, it should be once or twice. But as you can see how dirty this one was, you're going to do it multiple times until the lubricant comes out clear.
So you got a good 5 sprays out of that one before it became clear.
Absolutely.
Okay.
So then what you do is then you just bag your handpiece, sterilize it, and then it's ready for reuse.
Okay.
All right.
That's excellent. And occasionally we get the question, so they'll lubricate it before or after autoclave?
You don't have to lubricate after autoclaving because the synthetic lubricant withstands the autoclaving process.
Gotcha. So no matter how hot that autoclave is,
that's right,
it's not going to break up the...
So you only need to do it after the procedure. And then you lubricate, bag, and sterilize, and you're good to go.
Okay. I know a lot of you out there have the Aseptico 7000 motor, and the Mont Blanc 20-to-1 handpiece that we just saw was pretty dirty. And thank goodness for the lubrication spray, how you can clean it up. But so if you're interested in keeping your handpiece healthy, which I'm sure you are, please call Shatkin F.I.R.S.T and we'll get you a can of the lubrication spray sent out, and we'll get you the spray tip as well. I hope it was educational for everybody. John, we really appreciate you being with us on the Monday Morning Minute. Very kind of you. Keep on fixing Dr. Todd's handpieces for him. Yeah, I know you go through a lot. But yeah, we look forward to seeing everyone next week on the Monday Morning Minute. We've got a great back-to-school special. Anyone who's interested in buying any bendable mono dental implant, if you haven't tried the monos yet, you really have to give them a shot. These implants are absolutely phenomenal. They come in 3.0, 3.3, 3.7, 4.2, and 5.0. If you buy 5, we give you 1 free. If you buy 10, we're going to give you 2 free. If you buy 25, we give you 5 free. 50, we give you 10 free. You buy 100, we give you 20 free. Remember, mono bendable. It's a great implant if you haven't tried it. Give it a shot. And keep in mind, we have 2 courses coming up in Buffalo. On September 22nd and 23rd, that's a Friday and a Saturday, we're having an intro course on mini dental implants and mono dental implants here in Buffalo at the world's largest mini dental implant training facility. Hope to see everyone there in September. In October, we'll be on the road at the ADA SmileCon convention. Dr. Shatkin will be giving 2 lectures at the main stage down at the ADA. Our booth number is 2217, so come down and say hi to us in Orlando. And then we're back here in Buffalo for our advanced course, and it's going to be on the 16th, 17th, and 18th of November. On the 16th and 17th, we'll be lecturing on mini dental implants and monos. We'll also be talking a little bit about problem solving on some difficult cases. And on Saturday, November 18th, you have an optional day with Dr. Samuel Shatkin. He'll be training dentists on how to place Botox. You can have live patients here and work right on live patients, or you can choose to do the didactic portion. Completely up to you. We hope to see you up in Buffalo here at one of our courses or down at the SmileCon ADA convention in Orlando. And we hope you have a wonderful week placing our minimally invasive implants. See you next week on the Monday Morning Minute.